Hi, Kate. I'm Rachel from Physical Therapy. We're going to talk about breathing exercises and coughing after having a lung transplant. So probably the most important segment that we can talk about is, helping you learn how to take those deeper breaths, because that's been a challenge for a long time. So being able to really draw the air down into the lower lung fields and to be able to expand those airways, and helping with opening up the rib cage for rib mobility, being able to take those nice, slow, deep breaths, okay? So a couple of exercises that can help just anytime that you want to. You can do them sitting, you can do them laying down, is just abdominal breathing. So if you place your hands on your lower abdomen, all right, and then sitting nice and straight, looking straight ahead, chin tucked down just a little bit so you're looking straight ahead, and you want to try to breathe in through the nose and blow out through the mouth. Good. And it's good to just really focus on that quality of your breath. So try to breathe in nice and slow as much as you can, and then blow all the way out. So you don't want to rush this. You really want to take your time and not force it, but just really breathe in as far as you can, and then blow out. If you don't feel any movement in your hands, then that's a pretty good indicator that you're taking more shallow breaths. So you want to try to make sure that you feel that expansion, okay? Mm-hmm. Another one is called rib breathing. So you can take the palms of your hands and place them on your ribs. So another way to do it is to place your arms right next to your ribs. Just kind of firmly place the upper arms next to your rib cage so that you can feel the expansion of your ribs. Okay? Okay. So it's very subtle. I'm going to show you the ribs moving out, but it's a very subtle movement. Whether you're here, you can try here and take a slow, deep breath in, blow out, or try arms down by your sides, breathing in, blowing out. Another exercise that you probably have tried already is using the incentive spirometer. So just to review the proper technique and the most effective way to use this and to get the most, the best production of your secretions, you want to hold the incentive spirometer at eye level. So you want to sit as tall as you can, shoulders down. Try to relax your shoulders, looking straight ahead. And ideally you want to blow out outside of the tubing first, as much air as you can blow out. And then you want to place the mouthpiece into your mouth. Make a good seal with your lips and then suck in. Beautiful. And then blow out. Perfect, outside of the tubing. Okay, so there's two columns with the incentive spirometer. The number column, this is the quantity, how much air you're pulling into your lungs. So you want to go as high as you can, slow and deep. This column is the quality of your breath. So there's 3 boxes here: good, better, best. The bottom box is best. We want to try to keep the slow, deep breath. Will tell you that you're taking, if you're keeping it within the best to better boxes, that means you're taking a slow, deep breath. If you jump up to the good box, that means you're taking a quicker breath, and you're only going to move the air through the upper airways. So let's try one more time. We're going to try to keep it between the best to better boxes, the 2 bottom boxes, and then as high as you can. Good job. And then relax. And you want to allow the disc to come all the way to the bottom before you take the next breath. The other thing with this is on the handout of exercises, it's going to tell you to do 10 times every hour you're awake. This might facilitate a cough. You know, this is one of the things that we're hoping, you know, for you, that it will facilitate a cough as it's stirring up congestion that's settled in the lower lungs. However, you may not feel the urge to cough. After surgery, they've cut the nerves to your native lungs. So with the new lungs, you won't have that same connection from the brain to the lungs to say, I need to clear my airways. So you might have to cough on purpose. And for the beginning, we're going to ask you every time you use this, even if you don't feel the urge to cough, to just cough on purpose, okay? To make sure that you are trying to clear those airways out. You can use a folded blanket, you can use pillows, but if you have just an incision on one side called a thoracotomy, that would be with a single lung transplant, you would just wrap it around the one side, around the incision, okay? And just firmly press down. You can reach around just like that and hold your arm down as you take a nice deep breath. Sometimes if you don't feel any rumbling there, you don't feel a cough coming on, you can take 2 breaths, just nice and easy in and out. And then on the 3rd breath, breathing in, and then try to cough. Good. Okay. You can even lean into this if you need to, really provide support to that incision site as you're coughing, just whatever you need to try to help. It may not take the pain away 100%, but it'll help support that incision. Okay. Mm-hmm. If you have the clamshell, so it's on both sides, you can wrap this just around the front. Okay. And then wrap your arms around it. If you need to, you can have a blanket on both sides and just have one under each arm, whichever way it helps you. But typically you want to lean forward, really press the arms down, lean into it as you cough. Good. Very good.